Mumbai. He is the head of clinical pharmacology. Please welcome Dr. Vikram. It's a pleasure to welcome our esteemed and favorite executive director, sir, for this 13th foundation day. We completed 12 years yesterday, and from today onwards, it's the 13th year of the department. And I wish to specially thank sir, because in the past 3 years we have been celebrating Foundation Day only after he joined the institute. And when you look at I'll have a brief presentation of the department. You will see that what I had promised in the last year, we have taken it forward and done it. And it is all because कि yes, sir पूछेंगे नहीं तो sir ये करेंगे, इसलिए. So anyway, that thing is needed, isn't it? We need somebody to actually oversee what we are doing and whether we are doing it right or not. So in that lesson, and not without scolding, thoda sa pushing and nudging, that sort of support, and in whatever we do, and open access, like if we need any hospital activities, sir has always never said no. Anything we can go. When the hospital is all ours. In some hospitals, it's very difficult to get permission to go and actually see the patients and do prescription audit and other things. So in that way, sir has been very cooperative, and it's indeed a pleasure to welcome sir. My faculty colleagues who have made all this possible, the other staff, the postgraduate students from the department, the research staff, the research scholars, the PhD students, and the undergraduate students and the nursing students who are here. Faculty from other departments, Dr. Murli, and some of the residents from Professor Vaishali ma'am, Dean Exams. Please come forward. Thanks for coming, ma'am. With the permission of sir, I will present a small and brief annual report of this newspaper report marks the first day of this session 2024-25, and this was the last foundation day wherein Dr. Shoaib Mukherjee had come to give a wonderful talk. So sir, this was the last slide of the last year's foundation day, and we had promised you that we would expand regulatory clinical trials. Yes, today we have completed one regulatory clinical trial and given all the data and other things. Before I proceed further, I would like to welcome our officiating MS Medical Superintendent, Professor Purwar. Thanks for coming, Dr. Purwar. So we had promised to initiate outreach activity, and we have initiated. We have completed about 6 or 7 so far. Dr. Shilpa Kaur is coordinating the outreach activities, and increased PhD student intake. This we are slightly behind, but then last time we had only 1. Now I have 3 PhD students. So it has increased, and I think we need to look into this and increase this further. Initiate precision medicine services in collaboration with precision medicine. Yes, we are trying our best to this one, but in project mode through ICMR, we have started a little bit of this in psychiatry, the treatment of depression, especially with response to selective serotonin reuptake inhibitors. And we have a grant through Dr. Shubham Metal in collaboration with Harvard. But as on date, because of the political turmoil in the US, I do not know how the funds partially we have received. The remaining funds, I'm not very sure if it will be received or not. 2024-25 at a glance. Awards for faculty members in oral presentation, in paper presentations with both faculty members and residents. Extramural projects, I've completed 2 extramural projects. 3 projects have been granted extension beyond the timeline of 3 years, which was the initially promised extension. 2 new projects were initiated and 14 submitted, and 2 were partially approved, in the sense that we have been kept as a reserve site for patient recruitment for medical devices and clinical trials. Intramural 4, 2 faculty and 2 PG students have got intramural support for research. And publications, we have 29, out of which 19 are original research articles, including meta-analysis. And some of the very good journals like Lancet, Digital Lancet, which has an impact factor of around 7, and Journal of Affective Disorders, which has an impact factor of around 7. So these have been the two major landmark publications in the 2024-25. Overall publications, we have got 104 articles, including articles in the main Lancet and the New England Journal of Medicine, and with a cumulative impact factor of more than 300 over the period of the last 12 years. First 2 years, yes, we didn't have any publications at all from here, but then after that we slowly picked up, and then this can be said over the last 2 years. Yeah, we thought we couldn't organize an international conference because we have just 6 faculty members and a few residents. But then we took it as a challenge. But it was 1.5 years it took us to organize this conference. And believe me, हिंदी में बोलता हूँ, शादी बेटे बेटियों की शादी ऑर्गेनाइज करना आसान है, because we can choose whom we call and whom we do not call. But इनको society conference organize करना, international conference is very difficult, because there are some people whom we need to invite and उनके नखरे सहने ही पड़ते हैं. So it was a very difficult experience, but fortunately, and amazing support from my faculty, residents, and research staff. Even people who had come here in our department for 3 months for observerships, pharmacy students from other colleges, they worked day and night to make this conference a resounding success. I would request a round of applause for these people for making this conference a success. The other usual routine, some yearly activities which you do, undergraduate quiz, pharmacovigilance activities, material vigilance activities, because we are regional training center both for pharmacovigilance as well as for material vigilance. These are the student achievements. We got 2 students, Dr. Deshika and Dr. Gokul, who have got extramural funding for their thesis from ICMR for their MD thesis. And these 2 this student is a pharmacy student who has come as an observer, and she's got the best poster presentation in a conference. And even our MBBS student has managed to get the intramural grant. Faculty awards too deserve special mention. Dr. Shubham Atal, who was as a guest assistant professor or a faculty at Harvard for 2 weeks, and an invited lecture from Dr. Ratinder Judge at the International Society of Pharmacovigilance. Dr. Shubham has been working in pharmacogenomics, and Dr. Ratinder has been working in pharmacovigilance, and both of them have excelled in these areas, and I'm very happy. And many others, and the other faculty members also, have taken up areas which they are slowly excelling in, and that is a very encouraging thing for me as the head of the department. Of course, all the routine awards and many of the conferences wherein many of the faculty members have got prizes, first prize in oral presentations and poster presentations. These are some of the snapshots. 12 of our PG 6 year and 6 year, 12 of our postgraduate students and SRs have presented papers in conferences, and out of which 6 have received awards. In one form or the other, 6 have received awards. Look at the faces and look at the enthusiasm with which they are presented. So this is my last slide before I leave you with some of the glimpses. Sir, yes, we are in talks with Cipla and other companies, and with the Department of General Medicine and Pulmonary Medicine. So 3 clinical trials are in the pipeline, regulatory clinical trials. So with this institute, we'll also receive a little bit of financial support from these trials. Other than the patient costs being borne, the institute overheads also will be generated from these clinical trials. More PhD scholars, yes. I have asked for 9 PhD scholars this time. Let us see and hope how much we get. Initiate therapeutic drug monitoring. This slightly has run into rough waters, and yes, I hope this year I can proceed with initiating therapeutic drug monitoring. Initiate pharmacogenomic services in collaboration with Dr. Biswas, who is the heading the unit of precision medicine. We have made significant progress, and we should see this thing coming up. And the major thing is generation of real world evidence. Clinical trial में दवाई देके ये भूल जाना, मतलब because it is under controlled conditions. How the patient takes the drug, क्योंकि patient aaj lega, kal nahi lega. That is called real world evidence. That is what we have been trying to do. And we have one area wherein we have already started is diabetes, and already published a lot of papers on real world evidence. We actually take patients who either come to our OPD, or we go to the field and collect evidence for real world evidence. So that is where the use of drug in normal setting, it is not a controlled clinical trial setting. These are normal settings. क्योंकि हम और आप जब भी दवाई लेते हैं, इवन डॉक्टर्स आर वेरी दिसन 3 दिन में ठीक हो गया दिसन इन्फेक्शन तो एंटीबायोटिक स्टॉप कर देते हैं, हम भी तो स्टॉप कर देते हैं. So what actually happens in the field is called real world evidence. Today this has got a lot of बहुत मायने रखती है ये आजकल, this real world evidence. So this is what we are trying to do. We have started, we have published, but I think this year we'll consolidate this because we are going for outreach activities. There in that either the urban center or rural center, we will get hold of a catchment area, define a population, and then start our studies. And we are planning to start this in a big way. Thank you for your patient listening, and thanks sir for all your support in this lesson. I leave you with a few snapshots. This Topicon drew a lot of this one from both the WHO, the International Society of Pharmacovigilance, and other international players. These are our students, nursing students, UG students. I mean, this is wonderful. I have preserved them. I have framed it and kept it on the. These are wonderful posters. We have a lot of other articles also, because every other week we keep getting something, but then this is the key. This one over the year. Thank you so much. Thank you all for patiently listening.